So here's some bacteria that have contaminated a culture of embryos. Now, I remember one of the scariest times that I had was one day I was checking embryos. I believe it was on day 3. And I began as a human embryologist in 1991. And I didn't have my first example of contaminated culture until 2009. I went to check and I found a patient that had this rust-colored debris in embryo cultures. And the embryos looked like your typical burnt cinders, where they were just very dark and granulated. So those were probably dead embryos, and there was no way to rescue them. I checked all of the dishes and did not find it in any other patients, nor did I find it in dishes that had no embryos from this particular patient. It was only found in dishes that contained embryos. I quickly isolated all the media for testing so that the media or dishes would not be used until they were verified as not being the cause of this contamination. I removed the media from the affected cultures, as well as media from the sperm pellet and from the wash for the sperm. And I sent them off for culture and sensitivity. And the results came back that they were positive for Ralstonia, and they were traced eventually to the cryovials of frozen sperm, of which, fortunately, I had not frozen. But they were resistant to gentamicin, amikacin, and tobramycin. And these are all aminoglycosides types of antibiotics. So this started really getting me, well, I should mention, we did save this cycle, and we did it by doing another testicular biopsy. And back in these days, we had penicillin and streptomycin in our cultures for culturing. And so what we found out very early on using those two antibiotics is that penicillin had a very short half-life when it was at 37 degrees centigrade. And a lot of times we were putting our embryos in a system for selection of penicillin resistance. So this got me thinking, do we have variability in IVF outcomes? And could this be due to contamination events? And maybe contamination where you don't see a flocculant. It may be contamination, but it's not at a high enough concentration to see little bacteria. Also, can viruses affect our culture? What are the primary sources of these contamination events? How easy is it to contaminate our cultures? And does gentamicin, the common antibiotic in our media, protect cultures from contamination? This experience got me thinking along the following lines. Do we have variability in IVF outcomes due to contamination? Now, we need to remember that our air has a lot of microbes in it. And how easy is it to get contamination from the air? Our skin snows with microbes. These guys, whether they're bacteria or fungi, that they're everywhere. How easy is it to get contamination from the air? Well, Dahlstrom et al. Did a study where they opened 45 sterile trays and they left them open or covered. And afterwards, they measured the levels of bacteria in the cultures. And they found out that 3 of the 30 opened trays, the sterile ones, became contaminated immediately after opening. And after 4 hours, 30% were contaminated. And it didn't matter if there was a lot of traffic going in and out of the OR or not. But the towel-covered trays did not get contaminated. So obviously, in this situation, it's fairly easy for microbes to fall from the air or from our skin potentially and get contaminate our cultures. I did a kind of an unofficial survey at an embryology meeting once and asked embryologists what their experience was with contaminated culture. And as regards occurrence, 16% saw it once per year, and 60% or more saw it less than once every 3 years. And 40% have seen contamination of cultures 5 times in their life. When they reported what were the contamination events, It was split equally between bacteria and fungi. There was nothing reported for viral. That's because we don't test any of our cultures for viruses. And viruses usually don't have something overt that we can see, like flocculation. Now, there was a study that was done by Kimball et al. In Ireland in 1996, and they looked at the last 6 years. Another study was done by Castrop in 2007, and then one on yeast was done by Ben Chetry in 1996. And they found one contamination event on an average every 150 to 200 cases. Well, that means most of us should have one contamination event per year, but I doubt that we really do. Why don't we? The reason we probably don't is because these were all done in big box incubators, and a lot of them were probably done using just penicillin and streptomycin as an antibiotic. So Kimball, as I mentioned, did 30 IVF cycles, and this was a prospective study. And they had penicillin and streptomycin. They swabbed the vagina, and then they did one punch per ovary to look for bacteria in the ovary. And they cultured for bacteria at different stages. So this is a culture technique, which is not all that sensitive. When you culture bacteria, there's some bacteria that will not grow because you don't have the right conditions for them, as opposed to the more current techniques of looking at ribosomal RNA to determine what is in there. The results of this study was 50% of the cycles had some form of contamination without observing flocculation. 13% of the semen specimens were positive for bacteria or fungi, and 27% of follicle aspirates were positive. When they looked at the primary culture, 7% were positive 20 hours after insemination. So in that time with those systems, it was a fairly common event. So let's look at the possible source of this contamination. I think one of the major sources is semen. You know, we kind of think of semen as being sterile, but it is not. Kimball found it in 63% of semen specimens. He found some sort of contamination. 16% of these men had elevated leukocyte concentration, which may indicate some sort of ongoing infection, maybe prostatitis. Most of these were non-hemolytic streptococci and Staphylococcus epidermis. 14% had ureolicticum, and 4% had Mycoplasma hominis and ureolicticum. So 5% were positive after collection and after a swim up. So the swim up did not stop the bacteria from being moved in to the insemination dishes and consequently into the culture dishes. Now, as I mentioned earlier, lack of evidence does not constitute evidence. So we can't rely on all of these studies that were done a long time ago. But we can see there is a large number of cases and cycles that are contaminated, and you can see flocculants. But there's many clear cultures that I believe also may be contaminated and may be affecting our outcomes. Here is another analysis of contamination. This is retrospective from 14,000 IVF cycles. This is done by Castrop in 2007. They found a 0.7% incidence, which is about 1 out of 200. None of these were with ICSI. Penicillin and streptomycin were used, and sperm were prepared on 2-layer column and usually with a swim up after it. They washed the vagina with sterile saline. When they did this, E. coli was the most common contaminant, found in 60%, and 73% of these that had E. coli were resistant to penicillin or streptomycin. So they also found that 91% of all bacterial contaminants had antibiotic resistance. They found yeast, candida, let me go back here, in 25% of specimens. 41% were detected at fertilization check, and 59% of contamination events were detected when they changed media at day 2 or day 4. And we should remember that penicillin, its half-life is only a few hours at 37 degrees centigrade. Whenever bacteria was found in the cultures, they had poor embryo quality, but yeast didn't appear to have an effect on the embryo quality. And that's probably true in most cases, although it can starve the embryo of constituents that it's using for its metabolism. Now, since this group switched to gentamicin, they only found candida contamination in their cultures. And of course, gentamicin is not going to have an effect against a fungi. As I mentioned, there's no contamination in ICSI cycles. The major source was semen. Air didn't appear to be a source. And maybe that's because of the oil that's protecting it. But most likely, we can eliminate lab air as a source. And I remember an argument that I had with one embryologist who felt that embryologists were just sloppy in what they were doing, and they were the source of contamination events. I don't think that's true. Why? How can semen be a source of contamination? If we look for bacteria, a study done by Moretti showed that 30% of men had bacteria in semen. Almost all men had anaerobic bacteria in semen when Eggert Kruse et al. Studied semen. Another study by Kiesling in 2008, bacteria was found in 65% of men's semen. Some cases, there was more bacteria in semen than there were sperm. And we should remember, as relates to viruses, which we don't screen for, we don't measure them, herpes virus was found in 83% of men's semen by Neophyto in 2009. Now, this was not necessarily herpes simplex, but was other types of herpes too, such as cytomegalovirus. So one study was done about transferring of embryos that were exposed to yeast. I would probably have a hard time doing this, but they had 0.7% of cases with yeast. There were 5 cases. The embryo quality was normal. And all 5 patients that they transferred the embryos that were contaminated, they all conceived. To me, this is one of the breakthrough pieces of research that was done by a group in Australia, Pelser and Knox. They looked at 263 women undergoing IVF. So this is a prospective trial. All of them had bacteria in the follicular fluid. And then they also looked and found that 71% had organisms that were cultured from the vagina, not surprising. And there they felt that contaminants may be introduced into the ovary when a follicular aspiration is done or an embryo transfer. So that's why you can find so much contamination in aspirations or at embryo transfer. They had a lower pregnancy rate when they found the same bacteria in the vagina or uterus as related to the type of bacteria found in the embryo transfer media. They found that the antibiotics in media was not sufficient against all microorganisms. For example, gentamicin. It's usually mainly effective against gram-negative bacteria. They looked to see if bacteria was the same in the vagina, and they found half of those follicular aspirates had the same bacteria in the vagina, and 25% had unique bacteria in follicular fluid from the aspiration. So that they assume may have come from the ovaries. Now I want to talk about one thing that bothers me a lot. I call it the stealth disruptor. This is a microorganism that decreases cell growth, causes shift in the pH of media, It depletes cell substrates that an embryo can use for, or other cells can use for their metabolism. It induces oxidative stress. It produces ammonia. It secretes harmful metabolites, and it modifies DNA, RNA, and protein synthesis. It can outnumber a cell 1,000 to 1. You can observe it with a light microscope, and it's not a virus. It's pervasive. Half of all women in one study done by Idris had this bacteria in them. And I'm obviously speaking about mycoplasma, which is the smallest living organism known. It can pass through a 0.22 micron filter. So we probably have it in a lot of our media. You have to use 200 micrograms per milliliters of gentamicin to make it effective. And I think most of our media, someone can correct me later if I'm wrong, has about 10 micrograms per milliliter of gentamicin. And it doesn't show any overt signs when it's infected a cell. Now, I wanted to see how easy at one time it would be to infect a culture. So I used disposable 100 microliter Eppendorf pipette tips. And these are what I was using to contaminate. I would touch them for about 3 seconds. And I would touch them on the microscope surface. I would touch them on my skin. I would touch them on the ultrasound probe. And then I would have 5 drops that were covered with oil. And I would put those pipette tips in and touch those, swirl them around. And then I would culture them for a week. I found no visible growth in any of my intentional contaminations, except for a fungal contamination from the ultrasound probe. So it's not that easy to contaminate our dishes. That's probably why we don't see it very often. But that's mainly just looking, not for is there bacteria in there, but is there a flocculant being produced? What about viruses? They have unknown effects. We know that HPV can alter sperm motility. And we know that 83% of 172 men had herpes DNA, HHV6. Epstein-Barr virus was 40%, and cytomegalovirus were 56.9% found in semen. So what do you need to do when you see something like this? You need to determine the source of the microorganism. That's the most important thing. You don't want to keep on using that media or those plates that might be contaminated. You immediately should lock down anything that was used in that cycle and mark it as susceptible. Then you should send off a culture and sensitivity of the media or some media that's been placed in a dish. And you want to determine the antibiotic susceptibility of the microorganism. I know that this is difficult sometimes because hospital labs don't want to run something that's from a tissue culture dish. So you'll have to work that out with them, or you'll have to outright just not tell them what they're looking at. The next most important thing has to happen at a contamination event. You have to be open about it. You have to have a quick communication to the physician, quick communication to the risk management, and then as quick as possible, have an honest communication with the patient. And they should understand that in most cases, these come from the semen. Don't toss anything. Collect all your primary sources, as you see here. One of ours was a cryogenic vial, was one that we found. And then you could look at cryopreserved sister vials, or sister dishes, or dishes that didn't have sperm added to them, or dishes that didn't have embryos in them. And look at your secondary sources, the contact items, your plates, your sera, your media. In summary, then, overt contamination occurs in about 1 every 150 to 200 cycles. It's probably less often now. The source is almost always semen or follicular fluid. Follicular fluid and semen are not sterile. Most common contaminants are yeast, E. coli, mycoplasma, and staphylococcus, and most are antibiotic resistance. Thank you very much. I will now take you back to the moderators.